Slides?
Yes, ma'am. Yes, ma'am. It's visible.
Right. Very sorry. Caught in the net and, well, as usual, web. Okay. Well-being of women. Wow. So I think women should feel, sorry.
Ma'am,
Dr. Lata,
before
we
you...
have a small agenda.
Oh, sorry. Yeah. Very sorry. Yeah, if I have started the lecture.
It's okay, ma'am. It's completely fine. Ma'am, I'll just stop your screen sharing for a moment.
Please do.
After that, you can restart it, ma'am. With your permission, I'll stop it.
Please do.
Yes, ma'am.
Very
Thank you,
sorry. I thought you were all ready for the lecture. That's why
It's okay, ma'am. No
I just
problem.
had to sort of dash to my friend's house.
It's okay, ma'am. Thank you, ma'am. Thank you very much. Sir, shall I start?
Yeah, please go ahead.
Thank you, sir. A very good evening to everyone present here. I am Leo Tanmayi, immediate past president of Legacy Leo Club of Someshwarapura, District Even 7E. Lions Clubs of Bangalore, Someshwarapura organizes a monthly virtual webinar series called Doctor Speaks. We invite a doctor specialized in a particular field of healthcare. Today is the beginning of this series for this Lionistic year 2021 and 22. The topic for today's program is Wellness in Women, Adolescence to Menopause and Beyond. On this occasion, I would like to welcome Chief Guest. On this occasion, I would like to welcome Chief Guest and Guest Speaker, Dr. Lata Venkatram. We welcome you, Madam. Thank you. I would like to welcome our Leo Club Advisor and Senior Lion, PMCC, Lion Dr. S. Nagaraj Rao. We welcome you, sir.
Namaskara.
Thank you, sir. I would like to welcome DC for Leos, Lion Rajesh Dua, sir. We welcome you, sir.
We've got past Governor Shashi Kurana also.
Oh, I'm extremely sorry, sir. I'm extremely sorry. I would like to welcome PDG Lion Shashi Kurana, madam. We welcome you, ma'am. I would like to welcome DC for Soft Skills 317A, Lion Usha Malini, madam. We welcome you, ma'am. I would like to welcome RC Lion Dr. Albert David, sir. We welcome you, sir. I would like to welcome President of Lions Clubs of Someshwarapura, Lion Ken Srivasa. We welcome you, sir. I would also like to welcome Secretary Lion Bharat Bhushan and First VP Lion Suman Raju. We welcome you both. I would like to welcome all the Lions and Leos and all the students who are attending today's program. I welcome each and one once again. I welcome you all. I now call upon Leo Ila Saraf to introduce the chief guest, please.
Good evening, all. I'm Leo Ila Saraf. I'm a second-year medical student at MS Ramaya Medical College. So I'll just share my screen. Can you see my screen?
Yes, it's visible. Yes.
Okay. Oh, I don't know how to.
Yes, it's visible now.
Okay.
You can go ahead.
Okay. So Dr. Lata is the leader of the Gynecology and Obstetrics Department in Bhagwan Mahavir Jain Hospital in Girinagar. She is the force behind SB OBGYN, and her vision is to promote evidence and protocol-based healthcare of a high quality for all women. Dr. Lata's expertise spans an array of women's health conditions, which she uses to aid her community. She has garnered an expansive amount of technical expertise over her career of almost 3 decades. Dr. Lata is a highly skilled physician and surgeon who possesses a particular interest in managing high-risk pregnancies, treating medical disorders in pregnancy, and performing complex vaginal surgeries. She firmly believes that a comprehensive and multidisciplinary approach is the best way to provide care in as natural a way as possible. Along with being a notable physician who has performed countless normal vaginal deliveries, Dr. Lata has also trained hundreds of young professionals and advises other doctors who seek her counsel on complicated cases. She passionately works towards the decentralization of healthcare and increasing the availability of specialist care to less privileged parts of society. One of Dr. Lata's greatest interests throughout her career has been providing holistic healthcare to rural and tribal women. In pursuing this passion, she has developed low-cost technological applications which bring care to the community. And she has also adopted a corporation hospital in Bangalore to reach out to less fortunate people. She has also actively promoted the group practice concept in India as the best way to provide round-the-clock, efficient and quality healthcare. In addition to being an accomplished doctor and a fantastic human being with a great sense of humor, I might add, Dr. Lata has many other notable interests. She is a classical Carnatic singer, a dramatist, and as well, she is a poet. So, and with that, it is a great honor for me to introduce you to this gathering, madam. We welcome you once again. Thank you.
Thank you very much, Leo Ela. I now request guest speaker, chief guest, Dr. Lata Madam, to take over the session, please.
Thank you very much. Sorry, sorry for the delay. I apologize for that because there were technical problems and I had to dash to my friend's house. Thank you very much, Ila, for that elaborate introduction. I don't know whether I deserve it, but anyway, thank you. Um, Thank you, Dr. Reshma, and all her team, lions, lionesses, and I would say probably Leos or Cubs, who are really dedicated, doing dedicated work to the society. And I think I'm very honored and privileged to deliver this lecture, and I hope it would be useful in some ways to everybody. Thank you again. Yeah, let me just start sharing the screen if that is okay with you. Um, can you see the screen, please?
Yes, ma'am, it's visible, ma'am.
Visible, and yeah, it is in slideshow mode. I'm unable to make out.
Yes, ma'am, yes, ma'am.
Right. So, well-being of women. It's so very important that, yeah, just give me a second because these slides are not moving for whatever reason. Yeah. So it's very important that we talk about matraswasthyam, lokaswasthyam. That is, if the mother is well, the whole world will be well, and family becomes center of all human stages of life, just as the mother becomes the focal point of existence of all beings. So woman plays a very, very important role in the society, not only in the family, not only as a mother, but she is there everywhere as really a mother. So, well, women are very special. They are programmed to have some biorhythms which are very special to women. That is mainly the menstrual cycle, menarche, reproduction, and also menopause, or the privileged functions or programmed biorhythms, I would say, of women. So it is the menses actually is a very complex interaction or interplay of hormones that is starting from hypothalamus, which is in our brain, and then pituitary, ovary, and the uterus. The end result of all these hormones being in coordination is the manifestation of, or it manifests as menstruation. So Lot of things can affect menstruation. We'll come to it a bit later. So, what I would like to say is women's brain affects periods. Women's brain affects her reproduction. Women's brain affects her menopause or the cessation of periods. So the physiological changes, as I mentioned, menarche, pregnancy, and menopause. We'll just run through a few things. Anything which is, before that, I would like to say anything physiological, that is, all these three are really physiological. And if it is associated with stress, it can become disease like. So, let's just look at a few things in adolescence. Age of menarche is reducing. It is abnormal if it is less than 9 years if a girl attains menarche. If it is beyond 15 years, then also it is abnormal if she has not attained menarche. That is, menarche is the beginning of periods, as you all know. Periods can be irregular for 3-4 years after menarche. And if a girl is putting on weight or developing a lot of pimples or developing unwanted hair in areas which are sort of on the face, on the abdomen, on the breasts, and things like that, it is abnormal and you have to seek consultation. But otherwise, irregular periods for 3 to 4 years after menarche is not unusual. The menstrual problems that a woman faces could be irregular menstruation, heavy menstruation, scanty menstruation, and bleeding in between periods can be the menstrual problems that a woman can have. Sorry, my slides are somehow not moving. Just give me a second. Yeah. So, there could be a combination of these even in adolescence. I'd like to just touch upon the polycystic ovarian syndrome, which is a very, very common disorder that we are finding. It is a common hormonal disorder affecting the normal cyclical function of ovaries, resulting in irregular periods because of irregular ovulation, change in the normal hormonal balance affecting different systems in the body, including the pancreas. So it makes them more prone for diabetes, etc. So it can affect 1 in 4 girls or even 1 in 5 girls in our country. It is very, very common, and with girls becoming obese, I think it is perpetuating quite rapidly. Fat cells are the largest hormone producing glands in the body. Okay, so they are, I would say, they are largest endocrine, that is hormone producing glands in the body. So if the girl gains weight, the menses becomes irregular, and if the menses becomes irregular, they put on weight. So it becomes a vicious cycle, and the periods get irregular and scanty, and unwanted hair growth, hair loss in the right areas, hair growth in the wrong areas is one of the hallmarks of this problem. Acne, that is pimples, yeah, quite severe in nature, or black patches around the neck or the face, etc., etc., which indicates that these girls have insulin resistance and become more prone for diabetes. And also, not only these are short term effects, but the long term effects or the cardiovascular risk due to obesity and also higher cholesterol, higher blood pressure, diabetes, secondary to diabetes, also they can have cardiovascular risk. They can find it difficult to conceive, and even during pregnancy, they can have more problems like miscarriage, carrying a heavier baby, having diabetes, having blood pressure during pregnancy, having more operative deliveries, etc., etc. they're more prone for cancer, and also it distresses them. The weight distresses them. It's a sort of always a battle. Okay, the weight reduction is not going to be easy because it becomes a multiple endocrine or hormonal problem, and the weight can produce further distress. That stress itself might make them not lose weight, so this vicious cycle perpetuates. So it's very, very important to note the consequences of PCOS, and also what is the okay. So mantra is lifestyle change. We are more used to the malnutrition, MALL, okay, and also waste is disappearing, WAST, WAIST is disappearing, and WASTE is appearing, and lot of tires, so people feel more tired. So all these are unfortunately the consequences of PCOS, but the mantra is lifestyle. We might keep the periods regular, but one will have to lose weight. That is the main mantra by sort of, practicing diet, exercise, and also uh, yoga to reduce stress. So PCOS has become a very, very important issue for all NCDs, that is non-communicable diseases like diabetes, blood pressure, cancers, etc., etc. Sorry. So it is very, very important that we take note of PCOS, and prevention, early care with lifestyle change is the key to success. Moving on, many girls experience premenstrual syndrome. People can mark their periods, others can mark their periods. This is due to excess reaction of the body and the mind to a change in the hormonal milieu. That is, in the second phase of the cycle, the progesterone hormone is not a very, very nice hormone. Estrogen is a pink hormone, progesterone is a blue hormone, we would say. And premenstrual syndrome usually starts after 14 days, that is, after ovulation, where progesterone is the hormone which dominates, and it can build up to the period. And there can be quite a bit of physical symptoms from head to toe, as you can see in this slide, and psychological symptoms like depression, tension, irritability, anxiety, sleep disturbances. So all these can be part of premenstrual syndrome. So what do? It is an exaggerated response, as I said. Just treating with tablets is not going to be enough. Again and again, I'm stressing on lifestyle. So very, very important. I mean, this is a nice picture where even dog would know that the lady is having a premenstrual syndrome. So I'm still talking about adolescent girls. Sexually transmitted diseases are becoming very, very common. Unfortunately, sexual promiscuity has increased, and I think it is important that we give proper sex education. Prevention is the best method for sexually transmitted diseases, especially before marriage. It is important to educate them about casual sex and its effects. So, menstrual problems, just to touch upon, the normal menstrual cycle is anywhere between 28 to 35 days. Abnormal if it is less than 4 periods per year or less than 2 days of bleeding, or if it is more than 7 days of bleeding, or if it is beyond 35 days, that is also abnormal. Pain in the lower abdomen prior to periods is very, very common, and usually it reduces with the onset of flow. But pain throughout the periods is abnormal, and bleeding in between periods. So I think it is very, very important that we understand that 30% of women at some time in their lives seek consultation for abnormal uterine bleeding. The global epidemic of obesity has added on quite a bit to the problems that women have with their periods. And I think it's very, very important to make sure that we move to the left of the spectrum rather than to the right of the spectrum. See, in India, actually, 1 in 3 women, especially in the city, are obese. As I said, it is the waist, and waist is not visible at all. And the cutoff of BMI for Indian women is much less. BMI of body mass index of 23 to 25 is overweight, and anything above 25 is obese, according to the Indian or ICMR classification. Sorry, the central government classification. So I think it is very important to note that we are thin fat Indians. We accumulate fat in the upper abdomen, which is a very, very bad thing, which happens very commonly around the time of menopause, and it gives rise to many other health issues. So I think it is very important that we mind our weight, and we, yeah, this is not an uncommon scene in the streets of um, even Bangalore, isn't it? So, anyway, so coming back to obesity causing, going forward with menstrual problems, I think fibroids are very, very common nowadays, and it is actually perpetuated by the hormone estrogen, which is secreted by the fat cells also, not only the ovaries. So, if the woman is more fat, I think more fibroids can develop. Fibroids are just gritty mass of tissue in the musculature of the uterus. They rarely become cancerous. 1 in 1,000 fibroids can become cancerous. They might produce some symptoms like heavy bleeding or some pressure on the bladder or the bowel, but usually in 50% of women who have fibroids, they need not have any symptoms. So it's a very, very common thing. Once they have fibroids, it doesn't mean to say that they have to get their uterus out. It is a myth, and also not a very right practice to lose, to um, uh, remove uterus for especially asymptomatic, that is without any symptoms if they had fibroids. Endometriosis, I'm just touching upon various things. You might wonder whether it is an obstetric class or gynecological class, but I just wanted you to just have a sample of many things which can happen. So I touched upon adolescence. This is in the age group between 20 and 45. These are the common things that can happen: menstrual irregularities, fibroids, and endometriosis. The symptoms of endometriosis, that is, the lining of the cells from the lining of the womb are present outside the womb. That is either in the musculature of the womb, which is called as adenomyosis, and also on the ovaries, it can produce something like chocolate cysts, etc., which can cause a lot of pain during menstruation, painful intercourse, and also infertility, and also excessive bleeding, etc., etc. So this is not an uncommon thing. Again, it is perpetuated by stress. I'm stressing a lot on stress because anything physiological, menstruation is very, very physiological, but when added on with stress, it can become pathological or disease like. So if we can manage our lifestyle, most of these, the gynecologists will become almost jobless, I would say. Okay, in the reproductive period, I would like to say pregnancy is a very, very important event. No single period in human development provides a greater potential for long range payoff via a relatively short range period of enlightened metabolic manipulation. That is, what I mean to say is, mother is the one who gives the atmosphere that is in the womb for the physical and mental development of the baby, and that mental and physical development depends on her mental and physical health. So if the mother is healthy, ancient literature was full of it. If the mother is happy, baby will also grow well. If mother is happy, the IQ will be better for the baby. So it is being proven by science. So it is very, very important that we give the best to have the best. That happens during pregnancy. The milestones that we pass, how the first 9 months shape the rest of our life, is a very, very important topic that obstetrics is talking about. So lot about fetal programming, and fetal programming happens within the first few months of our life, when we are not even seen as individuals. So, if we really have to give the best, we have to do the best. As mothers, we have to give the best during this time. But people are not aware of it, unfortunately, and many people feel that it is a myth, etc., etc., because 98% of what we are today is what we owe it to our mother and the atmosphere that she has given in her womb. So we should be very grateful to what we are today, because that is how we have been shaped, and that is how we have been. Genes have been contributed by both the parents, but the epigenetics, that is the functionality of the gene, depends on how our mother has shaped us up in the womb. So it what happens in the womb lasts a lifetime. So everything, diabetes, blood pressure, heart attacks, your PCOS, everything, and your mental problems, everything is tracked back to the womb, especially the non-communicable diseases. These are the non-communicable diseases, and including cancers. So early environmental origins of the disease is a very big topic. So it depends on, again and again, mother's nutrition, stress levels, lifestyle. Many women are smoking, unfortunately, and alcohol has also become quite common, and exposure to chemicals and toxicants. Yeah, I mean, we eat out a lot, we take a lot of preserved food, lot of chemicals we ingest, we lot of, I mean, and also suboptimal oils, etc., etc. These all can, and also we can't, unfortunately, but stop breathing polluted air. And also there are what are called as endocrine disruptive chemicals, EDC, which have become a very major issue for causing problems, health issues in both adolescents, I mean both adults and also the growing fetus. And also if she is under a lot of stress, complications of pregnancy are also more. Paternal influence, father also influences. So lifestyle change is very, very important even prior to pregnancy. Even before a lady realizes that she is pregnant, when before she misses her periods, the fetus would have already started developing, because 14th 15th day of her cycle, she ovulates, and the fertilization would have taken place, and the implantation would have been taking place by day 22 23 of her cycle. And she usually misses her periods after 28 30 days. So all those early developments would have taken place even before she misses a period. So it's so very important to give the best in the preconceptional period, where the lady doesn't know which cycle she is going to conceive in. And also many women are diabetics. Unfortunately, diabetes influences the babies in the womb, and diabetic mothers can perpetuate diabetes through their progeny, and it can go on and on through generations. So what do we do? Preconception, I think, should plan pregnancy, mother and father in optimal good health, physical and mental health, managing pre-existing or long-term conditions, previous pregnancy conditions. Folic acid is very, very important. So this is paternal influence, or that is influence of father. Elevated, that is obesity and unhealthy diets, reduces the sperm quality. Okay, and impaired offspring health, because if the sperm quality is not good, obviously. So pregnancy care, it is very, very important to make sure that you don't get don't gain excessive weight, and also promoting vaginal delivery is very, very important. It is almost like baptism by birth, because the microbiomes, the gut microbiomes, that is the bacteria in the gut, actually get programmed as we travel through, as the baby traverses the pelvis. That is why the lard has given such a long period of labor, 10 to 12 hours or even more, because the baby has to get programmed, the gut has to get programmed by getting exposed to the vaginal microbiomes or the birth canal bacteria. So it's so very important that we encourage vaginal deliveries for our baby's immunity to get boosted. And also, gut is the second brain. There is direct communication between the neurotransmitters in the gut and also the brain neurotransmitters. So if you want an intelligent baby and also a healthy baby, I think it is important that you encourage your girls to have vaginal deliveries. So this is the influence. Maternal microbiome is influence. I mean, mode of delivery is very, very important, because the maternal microbiome, that is the bacteria, program the gut of the baby, and 80% of our immunity, the fighting back power, is gut immunity. So if you really want to have a good progeny, you should nurture it in the womb and also allow it to mature as much as possible. It's like a ripe fruit separating itself from the tree and full of nectar. That is how the baby should also be coming out. And we, unfortunately, as obstetricians, or you, unfortunately, as parents, keep on saying, look, I want the delivery on this particular date, this particular time. It is not, I mean, we should not be interfering with nature if we wanted the best quality fruit, that is the best quality progeny. And also, pregnancy is a great window of opportunity to see how the mother does in her future life. If she has diabetes during pregnancy, due to pregnancy, she has 50% chance that she can become diabetic in the next 5 to 10 years. If she has mental health issues, she can become quite ill in the next few years. And also, we have to be careful. If she has blood pressure during pregnancy, she can again have blood pressure. I mean, she can become overtly hypertensive in the next 5-10 years. 50% of them can become, even diabetes, 50% of them can become diabetic, overtly diabetic in the next 5-10 years. So pregnancy is a great window of opportunity to see how this mother is going to be health wise, and we can take precautions, advise her, and prevent these problems coming up. So, and also obesity, very, very important to make sure that she loses weight after pregnancy. Otherwise, they keep on accumulating. So pregnancy is a great opportunity both for the mother and the baby, as I said. And we should not be delivering our women prematurely, as I already shared with you. So moving on, I'm just going to go away from pregnancy. White discharge is one of the common things. Women should have discharge. White discharge is not a disease, but if it's abnormal if it is associated with itching, irritation, if it is blood stain, or if it is too much and you are wanting to use some protection and things like that. And it is not a cause for low backache, as women often think. And like anywhere in the body, women should have discharge, I mean, well, secretions in the cavity, and vagina is one of those places where they should have discharge. But it increases usually prior to periods and also 2 weeks later, as I have said, abnormal if it is associated with these. And diabetes is one of the very common causes for abnormal vaginal discharge, where there can be a lot of itching, irritation, etc. So cancers, women are more prone for cancers also. So especially if they smoke, they have multiple partners, Of late, even multiple partners are becoming very, very common. Remarriages, remarriages, and things like that. We do see they are more prone for cancer of the cervix, and there is a vaccine to prevent this. It is best taken before one becomes sexually active. Cancer of the womb, cancer of the ovaries, cancer of the tube, which is very, very rare. So these are, and also cancer of the breast. So awareness of possible symptoms, we should be aware. You can Google for symptoms, but you don't have to get caught in the web and net, as I already told you. Smoking alcohol can increase the cause, incidence of cancer. Weight is one of the important causes for breast cancer, uterine cancer, especially. So I think it's very important that we take care of the weight. HPV vaccines, I have told you, that's the only cancer prevention vaccine best taken prior to sexual activity, but limited use after one becomes sexually active. Breast cancer, breastfeeding reduces the incidence of breast cancer by nearly 40%. Mammogram fee should become routine probably at least by the age of 45, 50, and earlier if there is a family history of cancer. Self breast examination is very, very important for women. And usually if they are having periods, after every period they should be examining the breast. Any good source on the net will give you self breast examination technique. For women who have attained menopause, that is have stopped having periods, once a month, that is first of every month, they can check their breast. Ovarian cancer, unusual symptoms, usually difficult to diagnose, but if you had a family history of breast cancer, stomach cancer, etc., one might be prone for ovarian cancer. The pains of IT, yeah, I think I should add on a word of regarding the pains of IT, because back pain, neck pain, hand pain, eye pain, headache, all these, and also menstrual problems are very common, especially people who are working late nights or working in BPOs, because sleep is a biorhythm. Any biorhythm which, if there is a change, menses is also, that's why we call it as a sleep cycle, menstrual cycle, etc. Those are all biorhythms, very, very physiological or very normal, natural for women. But if that is disturbed, you can have menstrual problems also. So stress, emotional problems, all these can really affect women's life. So the middle and reproductive years, I think one should care for yourself first, because we care for the family, career, etc. Especially career orientation has become such a I wouldn't say phobia, but such a compulsive thing. I'm not saying that I'm also a very career orientated woman, but I think it is important to know that it has its limitation. We have to care for ourselves, and after all, we have come here for some more evolution, isn't it? So I think it is important that we care about our lifestyle changes and also family issues, etc. I just want to touch upon menopause. Menopause is the cessation of menstruation. If a lady doesn't have periods for a year, then we call it as menopause. And during the transition to menopause can start few years or few months prior to. She can have irregular periods, and also lots of these symptoms from head to toe, that is hot flushes, night sweats, sleep disturbances, muscle and joint pain, etc. And there can be reduced interest in sex, vaginal dryness, so many things, dryness of skin, weight gain, especially in the center part of the body, on especially on the upper abdomen. That is the culprit which can really put the blood pressure up, can of course put the weight up, it can alter the appetite, etc. And also, not only these symptoms, the long-term problems of menopause is brittleness of bone. Especially if a lady has menopause less than 40, it is called as premature menopause. The average age of menopause is anywhere between 45 to 52. Some people, some women go on for quite a few years, but as long as their cycles are regular and as long as they have checked it with their gynecologist that everything is all right, that is fine. But these are the common symptoms, as I said, and every woman goes through. But if she is under stress, it can become disease like. Okay, many people can feel very depressed, many people can feel very anxious, palpitations, unable to sleep. So one can lead to the other: sleeplessness, blood pressure further, lot of stress and sleeplessness, and that can perpetuate diabetes, that can perpetuate cardiac problems, that can perpetuate obesity due to uncontrolled eating, binging, etc., etc. So things can be linked to each other, and you can get into a whirlpool or a vicious cycle. So lifestyle changes, and sort of just putting oneself, just taking a step back and saying, look, why am I like this? What can I do about it? Can I diet? Can I exercise? Can I think better? So all these are very, very important to take a step back and look at oneself. Osteoporosis is the long-term problem. Bones can become weak, risk of fractures can increase, and especially if there is a family history of osteoporosis, that is brittleness, it can be, I mean, one has to go through a few investigations to make sure that they maintain their bone strength after menopause. Calcium can be taken, should be really taken, I would say, probably, I mean, after the age of 45 in our country, because the calcium that we take in the diet might not be sufficient. So I think it's very, very important to bear in mind that menopause is physiological, and there can be a lot of associated in problems, especially in the, I wouldn't say problems in the family, but there can be changes, aging parents, aging in-laws, retiring husband, and the husbands will have to say men pause. Okay, so it's just not menopause. Yeah, and me no pause. Sometimes women probably keep saying me no pause. Okay, so some people will be dashing around, splashing around. I think men have to put up, and I wouldn't say shut up, but put up. So they will have to take a pause and say, they will have to give a large margin to their wives and say, look, okay, okay, she is going through menopause. So I think understanding her symptoms is very, very important. And there will be adolescent children who can, I mean, and there is a steep generation gap nowadays. So lots of issues can be there. So as I said, anything physiological plus stress can become pathological. So it's very important to make sure that we don't add on stress. So stress and stressing and stressing on stress, because all these are physiological changes and they can become disease like. So diabetes, please check for diabetes every year. People would be undergoing screening. But I think BMI, that's the obesity, is the greatest culprit. So keep your weights down. Not that I'm any thin. Blood pressure, at least once in 6 months, you have to check. I'm sorry that it says 2 years here. Know your numbers, and 120/80 is a good number. And I think smoking, alcohol, salt reduction. Yeah, don't go off salt, but reduce salt if you are having hypertension or a tendency for it. Thyroid problems are becoming very, very common. Cannot really prevent it as one of the endocrine disruptive, I think, disease that we are having because of the chemicals. I think healthy food, etc., is very important. These are, I mean, diabetes, blood pressure, thyroid problem, cholesterol, all these can suddenly spring up during menopause. So beware, aware, and if you can keep your weight down, it will come down to a great extent. But do check for all these. So as I said, with this, I think I would say, yeah, later years, that is menopause and beyond, has received little attention. Many women present only with medical problems, but prevention is actually, yeah, better than cure. Very important to prevent these problems by knowing when they can come up, when they can spring up, and what can we do. And especially as I said, pregnancy can be a great opportunity of window of opportunity for assessing what this women's health is. The mantra is again and again the lifestyle changes, and take a small step every day to see a big effect. So say no to all these bakery products, etc., etc. Healthy food, plenty of fruits, vegetables, water. The half plate concept, that is, half the plate should be filled with vegetables, quarter plate with carbs, and quarter with proteins would be a good idea after 40. So I think the eat well plate concept again, and plenty of antioxidants and strategies are, as I said, diet, exercise. Every at least 5 days a week, at least you should have 30 minutes, that is 150 minutes per week. Okay, so it's very important. Anti-gravity exercises will help your insulin resistance greatly. So minimize the amount of time spent sedentary for extended periods, especially sitting in front of computers, sitting in front of televisions, etc. Add walking or biking to your commute. Take the stairs, turn on your favorite music and dance. Yoga and mindfulness about what you're doing. Yeah, yoga helps greatly, and it has shown to reduce the stress in very big studies, and it's been scientifically proven. So, early recognition of mental health like depression, stress, etc., etc., recognize it early and make sure that you spend by, I mean, uh, spending quality time itself is a stress buster with the family, within yourself. How many of us are learning music? How many of us are practicing music? How many of us are practicing other art forms or your own favorite hobbies? No time for anything. And we don't even sit with each other. We keep messaging from downstairs to upstairs. We keep messaging on our WhatsApp and say whatever we want to communicate, we communicate. The human interaction is coming down so much, and we are getting more and more self centered. That's really not good for us. As I said, yoga can lower the stress, and it improves the physical and mental health. So, I mean, the whole world is talking about yoga, which has perpetuated from India, and I think it is very important that we bring in lifestyle changes as a life course approach to prevent many of the problems that women go through. With this, I would like to come to the end of my talk. It was a lot of it filled in the yeah, almost yeah, um, 35 40 minutes. So I would be happy to take questions if time permits. Otherwise, yeah, I mean, probably you could pass on the questions through Dr. Reshma. I would be very happy to answer them. So thank you very much for your patient hearing, and it has been a really a downpour. Hopefully, not a confusion, but I hope you have come to some conclusions. Thank you.
Ma'am, with your permission, shall I stop your screen sharing?
Yes, please. Yes.
Thank you. Thank you, ma'am. Thank you very much, ma'am. It was indeed a great session, and I think especially the women and college students who have come here today, I think they learned a lot of new things. They discovered a lot of new things about women health, I believe. So with this, I acknowledge the presence of PDG Lion Suchitra Sudhir Madam. She happens to be a doctor from Kerala. And I also see the presence of Dr. Sangeeta Ma'am. We welcome you. Now the forum platform is open for discussion. I request those who have questions can unmute yourself and ask, or you can post it in the chat box as well. We'll read it out for you.
Leo Tanmay, may I ask?
Yes, yes, definitely. Please go ahead.
Thank you. First of all, Dr. Lata, thank you so much for this wonderful presentation. Within a few minutes, I think we got a brief of how to lead a healthy lifestyle, avoid mall or junk food, and eat healthy and reduce weight, all these things. I've written a lot of notes. Thank you very much.
Thank you.
I have a quick question. If we consume dairy products like milk, ghee, butter, curd, and dry fruits, fruits, vegetables on a regular basis, is it still required for us to consume supplement medicines like folic acid or multivitamins or calcium? Especially like in my case, I'm planning to have a child soon or not pregnant yet. Is it really mandatory or can we have like natural food and compensate for it?
Yeah, sure. See, only one thing that you need to have is folic acid. Folic acid is very important for rapidly developing cells, rapidly dividing, developing cells. Even if you ate a kilo of greens, which has the maximum folic acid, you might not get it. So we request you to have folic acid supplementation. 400 micrograms is enough. What you have otherwise should be a balanced diet. You're having nuts, which is good. A food high in antioxidants is what you really need to have, and plenty of water, 2 to 2.5 liters of water to wash out the toxins. That's I mean, so as you very rightly said, eat healthy, think healthy. Yeah, before even you miss your period, I think you understood that what I told you, because the early embryological development would have started actually. So that individual would be already sort of clinging on to the womb, and then the rapidly dividing cells. I mean, it would form an embryo by day 21. That is 4 days of your missed period. The cardiac activity will already be there, but it might not be seen on the scan up to 6 weeks. But that is the way things happen. So please maintain a healthy lifestyle as you already are doing. But folic acid is one supplementation which prevents structural abnormalities, because it is required for rapidly dividing cells.
Thank you very much, doctor, and we'll follow all the instructions that you gave. Thank you very much.
Thank you. Yeah. Quality progeny. You can tailor make your progeny. Yeah, baby's learning happens right from within. It just doesn't come out and just start learning and just, yeah, take off. So it is a process of continuing. Women have to bear this in. Unfortunately, not very many are aware, but the scientific concepts are coming out of late. But it was there in our ancient literature very, very much.
Thank you. Thank you very much. Very kind of you.
Yes, if anybody wants to ask a question, please go ahead.
Can I ask?
Please.
Yes, ma'am,
Hello.
please. Yes,
Yeah,
yes, please.
I'm Mugdha. So I'm 44-year-old. Namaste, doctor.
Namaste.
And thank you so much for this beautiful explanation. And I just want to know that I'm having irregular periods now,
Mhm.
and I'm having hair fall also.
Mm.
I'm losing
Yeah.
quite a lot of hair.
Mm.
So do I have to take any medication, or it's just a phase and it will pass on?
Yeah. Two things, Mukta. Are you putting on weight, if I may ask you?
Actually, during lockdown, I have put on, so I don't know whether it is because of that or.
Yeah. Okay. Right. Fine. See, one has to check for diabetes, thyroid, before I can say, yeah, these two can cause hair loss.
Okay.
Menopause itself can cause hair loss because estrogen is a beautifying hormone. So the skin changes, this hair texture changes, hair, you can have hair loss during menopause, so many things. So I think it's very important to exclude those two problems. But otherwise, please follow healthy lifestyle, especially antioxidants. I keep talking about antioxidants, but I think it's very important that we reduce weight. That will also see oxidative stress is caused by fat cells also. So I think it's very important to reduce weight. Whatever you have gained, or even if you want to go lower than that, that would be better. That will
Okay.
also help in the hair growth. And if well, coloring, the toxins, etc., etc., hair coloring, etc., etc., will again perpetuate the hair loss around this time. So I wouldn't say that it would be a very progressive loss, but you have to take care. Hmm. So
Yeah, so
please exclude diabetes and uh, thyroid.
thyroid and diabetes. And after that, do I have to take any medication?
For hair loss.
No, because I'm not understanding the reason. Is it because of the menopause or because I am experiencing this in this last 6 months or so?
Yeah, it could be menopause. It could be due to menopause, but there is no need for a hormone replacement treatment or menopausal hormone therapy for just hair loss. I think you have to take care of the hair by actually your lifestyle changes should take care of your hair. Okay, but I wouldn't say that you will get back the what can I say, the thickness of the hair,
Okay.
because it is menopausal also. There is actually, when the estrogens go down, the testosterone produced in the ovary, which continues, is the one which causes baldness. So
Okay.
I wouldn't say that it is entirely preventable, but it need not be progressive if you took
Huh.
care.
So how I should take care of my food or diet, is it?
Yeah, yeah. Lifestyle changes, diet, mainly antioxidant diet, nuts, etc., fruits, vegetables, less of carbs, cutting down on your fat, and also losing weight. All these help, but I wouldn't say that it will
Stop.
stop or yeah, make you grow hair like you had before.
But it will reduce, right?
Sorry,
I mean, it will reduce after
it will,
some time.
it will reduce. It will reduce.
Oh.
Yeah, and also stress levels.
Mm-hmm.
Stress levels are very, very important for hair loss. Anemia, stress levels, all these are very important.
Oh, okay, okay. I'll take care. Thank you so much.
Right.
Yes, yes, sir. Yes, sir. You can go ahead. Please unmute yourself. Yeah.
Yeah, good evening, madam. It's okay to talk to you in Kannada.
ಹೇಳ್ಬೋದು ಸರ್.
Madam, 1980, ನಾನು ಈಗ ನಿಮ್ದು ಇನ್ಫಾರ್ಮೇಶನ್ ಇಟ್ಸ್ ವೆರಿ ಅಥೆಂಟಿಕ್, ವೆರಿ ಇನ್ಫಾರ್ಮೇಟಿವ್, ವಂಡರ್ಫುಲ್ ಪ್ರೋಗ್ರಾಮ್.
ಥ್ಯಾಂಕ್ ಯು.
For whom they're educated and civilized and urban people, it's okay. But it is not reaching to the village people.
ಯಾವ್ದು ಹೇಳಿ?
ಈಗ ನೀವೆಲ್ಲ ಈಗ ಎಷ್ಟೆಲ್ಲ ಮೆಸೇಜ್ ಅವೇರ್ನೆಸ್ ಜಾಗೃತಿ ಮೂಡಿಸ್ತಾ ಇದ್ದೀರಾ,
ಹಾಂ.
ಅದು ರೂರಲ್ ಪ್ಲೇಸಲ್ಲಿ ಇರ್ತಕ್ಕಂಥ ಮಹಿಳೆಯರಿಗೆ,
ಹ್ಞೂ.
ಹೆಣ್ಮಕ್ಳಿಗೆ ತಲುಪಬೇಕು ಅನ್ನೋದು ನನ್ನ ಒಂದು ಅಭಿಲಾಷೆ.
ಹೌದು,
ಒಂದು
ಬೇಕಾಗಿರೋದು.
ಎರಡನೇದು 1987-88 ಒಂದು ರಜನಿ ಅಂತ ಒಂದು ಕಾರ್ಯಕ್ರಮ ಬರ್ತಾ ಇತ್ತು ಟಿವಿನಲ್ಲಿ, ಬ್ಲಾಕ್ ಅಂಡ್ ವೈಟ್, ನಿಮ್ಗೆ ಜ್ಞಾಪಕ ಇರಬೇಕು.
ಹೌದು.
ಶಾಲಿನಿ ರಜನೀಶ್ ಅನ್ನೋ ಲೇಡಿ ಆಕ್ಟಿವಿಸ್ಟು ಗ್ರಾಮೀಣ ಪ್ರದೇಶದಲ್ಲಿ ಇರ್ತಕ್ಕಂಥ ಮಹಿಳೆಯರು ಗುಡಿಸಿನಲ್ಲಿ ಇರ್ತಾರೆ, ಮಾಳಿಗೆ ಮನೆಯಲ್ಲಿ ಇರ್ತಾರೆ, ಅವರಿಗೆ ಸ್ಯಾನಿಟರಿ ನ್ಯಾಪ್ಕಿನ್ ಗೊತ್ತೇ ಇಲ್ಲ, ಒಂದು ಕ್ಲೀನ್ ಆಗಿರೋ ಬಟ್ಟೆ ಸಹ ಸಿಗ್ತಾ ಇಲ್ಲ ಅಂತ ಅವೇರ್ನೆಸ್ ಕ್ರಿಯೇಟ್ ಮಾಡಿದ್ರು. 25-30 ವರ್ಷ ಆದರೂ ಸಹ ಈಗಲೂ ಸಹ ಗ್ರಾಮೀಣ ಪ್ರದೇಶದಲ್ಲಿ ಇಲ್ಲ ಗೌರ್ಮೆಂಟ್ ಸ್ಕೂಲಲ್ಲಿ ಹುಡುಗಿಯರಿಗೆ ಅದು ಕ್ಲೀನ್ ಆಗಿರೋ ನ್ಯಾಪ್ಕಿನ್ ಸಿಗ್ತಾ ಇಲ್ಲ. ದಟ್ ಇಸ್ ಅ ಗ್ರೇಟ್ ಪೈನ್, ಸೋಷಿಯಲ್ ಪ್ರಾಬ್ಲಮ್ ಅದು. ನಾನು ಈ ಬಗ್ಗೆ ಒಂದ್ಸಾರಿ ಶಾಲಿನಿ ರಜನೀಶ್ ಅಂತೇಳಿ IAS ಆಫೀಸರ್, ವುಮೆನ್ ಅಂಡ್ ಚೈಲ್ಡ್ ವೆಲ್ಫೇರ್ ಡಿಪಾರ್ಟ್ಮೆಂಟಲ್ಲಿ ಪ್ರಿನ್ಸಿಪಲ್ ಸೆಕ್ರೆಟರಿ, ಅವ್ರಿಗೆ ಹೋಗಿ ನಾನು ಒಂದ್ಸಾರಿ ಪ್ರಶ್ನೆ ಮಾಡಿದೆ. ಆಂಧ್ರ ಪ್ರದೇಶದಲ್ಲಿ ಸರ್ಕಾರಿ ಹೈಸ್ಕೂಲಲ್ಲಿ ಇರ್ತಕ್ಕಂಥ ಗ್ರಾಮೀಣ ಮಕ್ಕಳಿಗೆ ನ್ಯಾಪ್ಕಿನ್ ಸಪ್ಲೈ ಮಾಡೋ ಒಂದು ಸ್ಕೀಮ್ ಬಂದಿದೆ, ಅದನ್ನು ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡ್ತೀನಿ ಅಂತ ಹೇಳಿ ಮಾಡಿದ್ರು ಅವರು. ಅದು ಒಂದು ಪ್ರಶ್ನೆ. 3-4 ವರ್ಷಗಳ ಹಿಂದೆ ಹಿಸ್ಟ್ರಾಕ್ಟಮಿ, ಸ್ಮಾಲ್ ಬೀಡಿಂಗ್ ಪರ್ಪಸ್ಗೆ ಹಿಸ್ಟ್ರಾಕ್ಟಮಿದು ಒಂದು ದೊಡ್ಡ ಸ್ಕ್ಯಾಂಡಲ್ ನಡೀತು. 6 ತಿಂಗಳು 1 ವರ್ಷಗಟ್ಟಲೆ ಪೇಪರಲ್ಲಿ ಬಂತು, ನಮಗೆ ಜ್ಞಾಪಕ ಇರ್ಬೋದು. ಅದರಲ್ಲಿ ಮೀಡಿಯೇಟರ್ಸ್ ಎಲ್ಲ ಸೇರಿ, ಡಾಕ್ಟರ್ಸ್ ಎಲ್ಲ ಸೇರಿ 25,000ದಿಂದ 40,000ವರೆಗೂ ಚಾರ್ಜ್ ಮಾಡಿ, ಜಸ್ಟ್ ಫಾರ್ ಎ ಸ್ಮಾಲ್ ರೀಸನ್ಸ್ ದೇ ಹಿಸ್ಟ್ರಾಕ್ಟಮಿ ಮಾಡಿ ದೇ ಯೂಸ್ ದ ಸೀಸರ್ಸ್. ಆಮೇಲೆ ಸೆಲ್ಫ್ ಡಿಟರ್ಮಿನೇಷನ್ ಆಫ್ ಸೆಕ್ಸ್ ಆಕ್ಟಿವಿಟೀಸ್, ಡಿಟರ್ಮಿನೇಷನ್ ಆಫ್ ಸೆಕ್ಸ್ ಇದೆಯಲ್ಲ, ಅದಕ್ಕೆ ನಮ್ಮ ಬಹಳಷ್ಟು ಎಜುಕೇಟೆಡ್ ವುಮೆನ್ಸ್ ಇದಾರಲ್ಲ, ಅದು ಭಾಳ ಮಿಸ್ಯೂಸ್ ಆಗ್ತಾ ಇದೆ. ಮಹಿಳೆಯರ ಗರ್ಭಕೋಶದ ಮೇಲೆ ಕತ್ತರಿ ಪ್ರಯೋಗ ಆಗ್ತಾ ಇದೆ ಮೇಡಮ್. ಇದ್ರ ಬಗ್ಗೆನೂ ಅವೇರ್ನೆಸ್ ಬರಬೇಕು ಅನ್ನೋದು ನನ್ನ ಅಭಿಲಾಷೆ. ನಾನು ಸೋಷಿಯಲ್ ಸಮಸ್ಯೆಗಳನ್ನು ಹೇಳ್ತಾ ಇದ್ದೀನಿ ನಾನು.
ಹೌದು, ತುಂಬ ಸತ್ಯ. ಒಂದು ಮೊದಲನೇದಾಗಿ ನೀವು ಈ ಪ್ಯಾಡ್ಸ್ ಬಗ್ಗೆ ಹೇಳಿದ್ರಲ್ಲ, ಸ್ಯಾನಿಟರಿ ಪ್ಯಾಡ್ಸ್ ಬಗ್ಗೆ, ಹೈಜೀನ್ ಬಗ್ಗೆ ಮಕ್ಕಳಿಗೆ ಹೇಳ್ಕೊಡ್ಬೇಕಾಗಿರೋದು ತಾಯಂದ್ರ ಕರ್ತವ್ಯ, ಮತ್ತು ಡಾಕ್ಟರ್ಗಳ ಕರ್ತವ್ಯ, ಸೋಷಿಯಲ್ ಅವೇರ್ನೆಸ್ಸು, NGOs ಎಲ್ಲನೂ ಕೂಡ ಏನೇನು ಕೆಲಸ ಮಾಡ್ತಾ ಇದ್ದಾರೋ ಅವರೆಲ್ಲನೂ ಕೂಡ ಮಾಡ್ತಾ ಇದ್ದಾರೆ, ಸಾಕಷ್ಟು ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಆದರೆ ಇನ್ನು ನಮ್ಮ ದೇಶಕ್ಕೆ ಎಷ್ಟು ಮಾಡಿದ್ರು ಸಾಲದು. ಆದರೆ ಮೆನ್ಸ್ಟ್ರಲ್ ಹೈಜೀನ್ ಬಗ್ಗೆ ಪ್ಯಾಡ್ಸೇ ಆಗಬೇಕಾಗಿಲ್ಲ, ಬಟ್ಟೆಯನ್ನು ಉಪಯೋಗಿಸಿದ್ರು ಕೂಡ ಹೇಗೆ ಕ್ಲೀನಾಗಿ ಇಟ್ಕೋಬೇಕು, ಹೇಗೆ ಉಪಯೋಗಿಸ್ಬೇಕು, ಹೇಗೆ ಒಕ್ಕೋಬೇಕು ಎಕ್ಸೆಟ್ರಾ ಅಂತನ್ನೋದನ್ನು ಹೇಳೋದು ತುಂಬ ಮುಖ್ಯ. ಈಗ ತಿರ್ಗಾ ಕಾಟನ್ ಪ್ಯಾಡ್ಸ್ಗೆ ಬರ್ತಾ ಇದ್ದಾರೆ. ಕಾಟನನ್ನು ಯೂಸ್ ಮಾಡಬೇಕು, ಬಟ್ಟೆಯನ್ನು ಯೂಸ್ ಮಾಡಬೇಕು. ಯಾಕೆಂತಂತಂದರೆ ಸುಮ್ಮನೆ ಸ್ಯಾನಿಟರಿ ಪ್ಯಾಡ್ಸನ್ನು ಯೂಸ್ ಮಾಡಿ ಹಾಕೋದ್ರಿಂದ ಎನ್ವೈರ್ಮೆಂಟಲ್
ಅದು ವೇಸ್ಟೇಜ್ ಎಲ್ಲ ಸಮುದ್ರಕ್ಕೆ ಸೇರ್ತಾ ಇದೆ ಅಂತ ವರದಿ ಹೇಳ್ತಾ ಇದೆ ಮೇಡಮ್.
ಅಂತಂತ ಅದಕ್ಕೆ ನಾವು ಖಂಡಿತವಾಗ್ಲೂ ಹೇಳ್ಕೊಡ್ಬೇಕು. ಅದನ್ನು ಸಂಸ್ಥೆಗಳು ಮಾಡ್ತಾ ಇದೆ. ಬೇಕಾದರೆ ನಿಮಗೆ ನೆಟ್ವರ್ಕ್ ಇದ್ದರೆ ನಾನು ಅದನ್ನು ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡಿಕೊಡ್ತೀನಿ, ಮತ್ತು ನಾವು ಕೂಡ ಅದರಲ್ಲಿ ಭಾಗವಹಿಸ್ಬೋದು. ನಮ್ಮ ಟೀಮ್ ಆಫ್ 10 ಡಾಕ್ಟರ್ಸ್ ಅಂಡರ್ ಸೌತ್ ಬ್ಯಾಂಗ್ಳೂರು OBGYN ಖಂಡಿತವಾಗ್ಲೂ ಅದ್ರ ಬಗ್ಗೆ ತುಂಬ ಕಾಳಜಿ ಇದೆ, ಅದನ್ನು ಮಾಡಬಹುದು. ಒಂದು ಇನ್ನೊಂದು ಈ ಹಿಸ್ಟೆಕ್ಟಮಿ ಬಗ್ಗೆ. ಹಿಸ್ಟೆಕ್ಟಮಿ ಒಂದೇ ಅಲ್ಲ, ಸಿಸೇರಿಯನ್ ಸೆಕ್ಷನ್ಸ್ ಬಗ್ಗೆನೂ ಕೂಡ ತುಂಬ ಸಿಸೇರಿಯನ್ಗಳು ಆಗ್ತಾ ಇದೆ. WHO ಹೇಳ್ತಾ ಇರೋದು 15% ಮೇಲೆ, ಅಂದರೆ 100ರಲ್ಲಿ 15 ಹೆಂಗಸರಿಗಿಂತ ಜಾಸ್ತಿಯಾಗಿ ಸಿಸೇರಿಯನ್ ಆಗಬಾರ್ದು ಅಂತಂದ್ಬಿಟ್ಟು. ತುಂಬ ನಮ್ಮ ದೇಶದಲ್ಲಂತೂ ಉಲ್ಟಾ ಆಗೋಗಿದೆ ರೇಷಿಯೋ. ನಾರ್ಮಲ್ ಡೆಲಿವರಿ ಮುಂದಿನ ಪೀಳಿಗೆಗೆ ಉತ್ತಮ ಅಲ್ಲ ಅಂತನ್ನೋದು ಹೇಳಬೇಕು. ಯಾಕೆಂತಂದರೆ ಈ ಗಟ್ಟು ಇಮ್ಯುನಿಟಿಯಿಂದ, ಈ ಪ್ರೋಗ್ರಾಮಿಂಗ್ ಆಗೋದ್ರಿಂದನೇ ಡಯಾಬಿಟಿಸು, ಒಬಿಸಿಟಿ, ಮತ್ತು ಅದರಿಂದ ಲಿಪಿಡ್ ಪ್ರಾಬ್ಲಮ್ಸು, ಅದರಿಂದ ಹಾರ್ಟ್ ಪ್ರಾಬ್ಲಮ್ಸು ಎಕ್ಸೆಟ್ರಾ ಅದೆಲ್ಲನೂ ಕೂಡ ಈ ಗಟ್ ಪ್ರೋಗ್ರಾಮಿಂಗ್ ಹೆಂಗಿದೆ ಅನ್ನೋದ್ರ ಮೇಲೆ. ಆಮೇಲೆ ಆಸ್ಥಮಾ, ಅದರ ಇಮ್ಯುನಲಾಜಿಕಲ್ ಡಿಸೀಸಸ್ ಅಂತ ಹೇಳ್ತೀವಿ, ಅದೆಲ್ಲನೂ ಕೂಡ ಪ್ರಿವೆಂಟ್ ಮಾಡೋದಕ್ಕೆ ನಾವು ವಿಜೈನಲ್ ಡೆಲಿವರೀಸನ್ನು ಎನ್ಕರೇಜ್ ಮಾಡಬೇಕು ಅಂತಂತ ಕಳಕಳಿಯಿಂದ ಕೇಳ್ಕೊಳ್ತೀನಿ. ಆದರೆ ಮಗುಗೆ ಏನು ರಿಸ್ಕ್ ಮಾಡೋದಿಲ್ಲ. ಮುಂಚೆ ಏನು ರಿಸ್ಕ್ ಆಗ್ತಾ ಇತ್ತೆ, ಈಗಲೂ ಕೂಡ ರಿಸ್ಕ್ ಮಾಡಬೇಕಾಗಿಲ್ಲ. ಆ್ಯಕ್ಚುಲಾಗಿ ನಮಗೆ ಸಾಕಷ್ಟು ಗ್ಯಾಡ್ಜೆಟ್ಸ್ ಇದೆ ಮಗುವಿನ ಆರೋಗ್ಯವನ್ನು ತಪಾಸಣೆ ಮಾಡೋದಕ್ಕೆ. ಅದು ಸಿಸೇರಿಯನ್ ಸೆಕ್ಷನ್ ಬಗ್ಗೆ ಹೇಳ್ತಾ ಇದ್ದೀನಿ. ಇನ್ನೊಂದು ಹಿಸ್ಟೆಕ್ಟಮಿ ಬಗ್ಗೆ. ಚಿಕ್ಕವ್ರಿಗೆಲ್ಲ ನೀವು ಹೇಳ್ತಾ ಇರೋದು, ಫೈಬ್ರಾಯ್ಡ್ ಕಂಡ್ರೆ ಅಥವಾ ಇನ್ನೇನೋ ಆದರೆ ಅದು ಏನು, ಇವಾಗ ಬೆರಳಿಗೆ ಮುಳ್ಳು ಹತ್ಕೊಂಡಿದ್ರೆ ಮುಳ್ಳನ್ನು ತೆಗಿಬೇಕೇ ಹೊರತು ಬೆರಳನ್ನೇ ತೆಗೆದು ಬಿಡೋ ಹಂಗೆ ಆಗೋಗಿದೆ. ಸೊ ಮುಳ್ಳು ತೆಗಿಯೋಕ್ಕೆ ಯಾರು ಪ್ರಯತ್ನನೇ ಪಡ್ತಾ ಇಲ್ಲ ಅನ್ನೋ ತರಹ ಆಗೋಗಿದೆ. ಅದಕ್ಕೆ ಅದೊಂದು ಹಿಸ್ಟೆಕ್ಟಮಿ ಮಾಡಿದ್ರೆ ಏನೋ ಒಂದು ಸತಿಗೆಲ್ಲ ಅದು ಹೆಂಗಿದ್ರು ಆ ಬ್ಯಾಗು ನಮಗೇನು ಗರ್ಭಕೋಶ ನಮಗೇನು ಯೂಸ್ ಇಲ್ಲ ಅಂತ ಖಂಡಿತವಾಗ್ಲೂ ಅನ್ಕೋಬಾರ್ದು. ಹೆಂಗಸರಿಂದ ಬರಬೇಕು ಈ ಮೋಟಿವೇಶನ್. ಈ ಗರ್ಭಕೋಶವನ್ನು ಮುಂಚಿತವಾಗಿ ತೆಗೆದ್ರೆ, ಒಂದು 45 ವಯಸ್ಸಿಗೆ ಮುಂಚಿತವಾಗಿ ತೆಗೆದ್ರೆ 5ರಲ್ಲಿ ಒಬ್ಬರಿಗೆ ಓವರೀಸನ್ನು, ನಾವು ಅಂಡಾಶಯವನ್ನು ಉಳಿಸಿದ್ರೂ ಕೂಡ ಅದು ಕೆಲಸ ಮಾಡೋದನ್ನು 5ರಲ್ಲಿ ಒಬ್ಬರಿಗೆ ನಿಂತು ಹೋಗಬಹುದು. ಅಂದರೆ ಹಿಸ್ಟೆಕ್ಟಮಿ ಇವಾಗ 100 ಜನಕ್ಕೆ ಮಾಡಿದ್ರೆ 20 ಜನಕ್ಕೆ ಓವರೀಸು ಕೆಲಸ ಮಾಡೋದು ನಿಲ್ಲಿಸ್ಬೋದು. ಓವರೀಸ್ ಕೆಲಸ ಮಾಡೋದು ನಿಲ್ಲಿಸಿದ್ರೆ ಇದ್ದಕ್ಕಿದ್ದಂಗೆ ಮೆನೋಪಾಸ್ ತರಹ ಆಗಬಹುದು. ಸೊ ಹಾಗಾಗಿ ಬೇಗ ಪ್ರಿಮೆಚ್ಯೂರ್ ಮೆನೋಪಾಸ್ಗೆ ಎಡೆ ಕೊಟ್ಟಂಗಾಗುತ್ತೆ. ಮುಂದಕ್ಕೆ ಆಸ್ಟಿಯೋಪೊರೋಸಿಸ್ಸು, ಹಾರ್ಟ್ ಪ್ರಾಬ್ಲಮ್ಸು, ಇಲ್ಲದೆ ಸಾಕಷ್ಟು ಪ್ರಾಬ್ಲಮ್ಸು ಬರೋವಂಥ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ. ಅದರಿಂದ ಗರ್ಭಕೋಶ ಇಟ್ಸ್ ನಾಟ್ ಎ ಯೂಸ್ ಆ್ಯಂಡ್ ಥ್ರೋ ಆರ್ಗನ್, ಪ್ಲಾಸ್ಟಿಕ್ ಬ್ಯಾಗ್ ತರಹ ಅಲ್ಲ ಅದು. ಸೊ ಅಷ್ಟೊಂದು ಬುದ್ಧಿವಂತನಾದ ಭಗವಂತ ಆ ತರಹ ಮಕ್ಕಳು ಬಂದಾದ್ಮೇಲೆ ಇದು ವೇಸ್ಟ್ ಸ್ಟ್ರಕ್ಚರ್ ಅಂತಂತಂದರೆ ಅವನೇ ಹೊರಗೆ ಹಾಕ್ಬಿಡ್ತಾ ಇದ್ದ. ಸೊ ಇಟ್ ಈಸ್ ಎ ಸ್ಟ್ರಕ್ಚರ್ which actually is gaining more and more prominence to say whether it also produces some hormones ಅಂತನ್ನೋದನ್ನು ಈಗ ಬೇಕಾದಷ್ಟು ಅದ್ರ ಬಗ್ಗೆ ಮಾತಾಡ್ತಾ ಇದ್ದಾರೆ. ಯಾಕೆಂದರೆ ಓವರೀಸನ್ನು ಉಳಿಸಿದ್ರೂ ಕೂಡ ಓವರೀಸ್ ಕೆಲಸ ಮಾಡೋದು ನಿಲ್ಲಿಸ್ಬಿಡುತ್ತೆ ಕೆಲವರಲ್ಲಿ ಅಂತ ಯೋಚನೆ ಮಾಡಬೇಕಾಗಿರುವಂಥ ವಿಷಯ. ನೀವು ತುಂಬ ಸರಿಯಾಗಿ ಹೇಳಿದ್ರಿ. ಬಟ್ ದಟ್ ಅವೇರ್ನೆಸ್ ಶುಡ್ ಬಿ ಕ್ರಿಯೇಟೆಡ್, ಹೆಲ್ತ್ ಎಜುಕೇಷನ್ ಶುಡ್ ಬಿ ಕ್ರಿಯೇಟೆಡ್ ಆ್ಯಂಡ್ ರೈಟ್ಲಿ ಕ್ರಿಯೇಟೆಡ್. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್.
ಮೇಡಮ್ ಇನ್ನೊಂದು ಪ್ರಶ್ನೆ.
Thank you very much, ma'am.
ವೆಜಿನಲ್ ಡೆಲಿವರಿ ಬಗ್ಗೆ ಎಪಿಸೋಟಮಿ ಇದೆ, ಫೋರ್ಸೆಪ್ಸ್ ಇದೆ, ಬೇರೆ ಟೆಕ್ನಿಕ್ಸ್ ಎಲ್ಲ ಇದೆ. ಅದ್ರ ಬಗ್ಗೆ ಹೆಣ್ಮಕ್ಳಲ್ಲಿ ಜಾಸ್ತಿ ಅವೇರ್ನೆಸ್ ಬರಬೇಕು. ದೇ ಶುಡ್ ಅವಾಯ್ಡ್ ದಟ್ ಸಿಸೇರಿಯನ್. ದಟ್ ಇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್.
ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಅದಕ್ಕೆ ಥ್ಯಾಂಕ್ ಯು ಆಸ್ ಎ ದೋ ಇಟ್ ವಾಸ್ ಎ ವುಮೆನ್ಸ್ ವೆಲ್ ಬೀಯಿಂಗ್ ಅಂತಂತಂದ್ರು ಕೂಡ ಮೆನ್ ಆಲ್ಸೋ ಆರ್ ಕೇರಿಂಗ್ ಫಾರ್ ವೆಲ್ ಬೀಯಿಂಗ್ ಅಂತಂತ ನೋಡಿ ಸಂತೋಷ ಆಯಿತು. ಸೊ ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್. ಯುವರ್ ಪಾಯಿಂಟ್ಸ್ ವೆಲ್ ಟೇಕನ್. ಥ್ಯಾಂಕ್ ಯು.
Thank you very much, ma'am. We have time for a couple of questions. ಅಭಯಾಶ್ರಮದ ಮಕ್ಳಿಗೆ ಏನಾದ್ರು ಕ್ವೆಶನ್ ಕೇಳೋದಿದ್ರೆ ಪ್ಲೀಸ್ ಕೇಳಿ. ಹೆಣ್ಮಕ್ಳಿದ್ದೀರಾ, ಪ್ಲೀಸ್ ಡೋಂಟ್ ಹೆಸಿಟೇಟ್. ಯು ಕ್ಯಾನ್ ಆಸ್ಕ್. ಯು ಜಸ್ಟ್ ಸಾ ಮೇಡಮ್ ಸ್ಪೀಕಿಂಗ್ ವೆಲ್ ಇನ್ ಕನ್ನಡ, ಸೊ ನೀವು ಹೆಸಿಟೇಷನ್ ಇಲ್ಲದೆ ಏನಾದ್ರು ಪ್ರಶ್ನೆ ಕೇಳೋದಿದ್ರೆ ಕೇಳಬಹುದು.
ಕೇಳ್ಬೋದಮ್ಮ. ತುಂಬಾ ಸಂತೋಷ ಬರ್ತೀರಾ ಅಂತಂದ್ರೆ.
ಹಲೋ ಮೇಡಮ್,
ಹೇಳಿಮ್ಮ.
ನನ್ನ ಹೆಸರು ಮಾಧುರಿ. ನನಗೆ 45 ಇಯರ್ಸ್ ಮೇಡಮ್. ಇವಾಗ ಇರ್ರೆಗ್ಯುಲರ್ ಪೀರಿಯಡ್ಸ್ ಆಗ್ತಿತ್ತು. ಮೆರಿನಾ ಕಾಯಿಲ್ ಹಾಕ್ಸ್ಕೊಂಡೆ, ಆಮೇಲೆ ಸೆಟ್ ಆಗಿಲ್ಲ. ಆಫ್ಟರ್ 1 ಇಯರ್ ರಿಮೂವ್ ಮಾಡಿದೆ. ಆವಾಗ ಅಡಿನೋಮೈಸಿಸ್ ಅಂತ ಗೊತ್ತಾಯ್ತು. ಇವಾಗ ಮತ್ತೆ ಹಾಕ್ಸ್ಕೊಂಡಿದೀನಿ. ಅವ್ರು ಹಿಸ್ಟೆಕ್ಟಮಿ ಸಜೆಸ್ಟ್ ಮಾಡ್ತಿದ್ದಾರೆ. ಅದು ಹಿಸ್ಟೆಕ್ಟಮಿ ಮಾಡಿಸ್ಕೋಬೇಕಾ ಮತ್ತೆ ವೆಯ್ಟ್ ಮಾಡ್ಬೇಕಾ ಮೇಡಮ್?
ಮತ್ತೆ ಹಾಕಿಸ್ಕೊಂಡು ಇವಾಗ ಪೀರಿಯಡ್ಸ್ ಏನೇನು ತೊಂದರೆಗಳಿತ್ತು ಅದೆಲ್ಲ ಕಂಟ್ರೋಲ್ ನಲ್ಲಿ ಇದ್ರೆ ಯೋಚನೆ ಮಾಡ್ಬೇಕಾಗಿಲ್ಲಮ್ಮ. ಹಂಗೆ ಮೆನಪಾಸ್ ತಳ್ಬಿಡ್ಬೋದು. ಆಮೇಲೆ ಇದು ಮೆರಿನಾನಲ್ಲಿ ಕೆಲವು ಪ್ರಾಬ್ಲಮ್ಸ್ ಬಂದರೂ ಕೂಡ ಅದಕ್ಕೆ ಬೇರೆ ಮಾತ್ರೆಗಳನ್ನ, ಬೇರೆ ಔಷಧಿಗಳನ್ನ ಕೊಟ್ಟು ಅದನ್ನ ಮ್ಯಾನೇಜ್ ಮಾಡ್ಬೋದು.
ಕೊಟ್ಟಿದ್ದಾರೆ ಮೇಡಮ್, ರೆಜಿಸ್ಟ್ರಾನ್ ಅಂತ ಕೊಟ್ಟಿದ್ದಾರೆ 21 ಡೇಸ್ಗೆ.
ಇಲ್ಲಮ್ಮ, ರೆಜಿಸ್ಟ್ರಾನ್ ಇಂದ ಹೆಲ್ಪ್ ಆಗದೆ ಇರಬಹುದು. ಅದಕ್ಕೆ ವೈಯಕ್ತಿಕವಾಗಿ ಅದನ್ನ ಪರ್ಸನಲ್ ಆಗಿ ಯಾವಾಗ್ಲಾದ್ರೂ ಮಾತಾಡೋಣ. ಬಟ್ ನೀವು ಮೈರಿನ ಹಾಕೊಂಡು ನಿಮಗೆ ಬೇರೆ ತರಹ ಕಂಟ್ರೋಲ್ ಆಗಿದೆ ಅಂತಂತಂದ್ರೆ ಅದನ್ನ ಮುಂದುವರಿಸಬಹುದು ಅಂತಂತ ನನ್ನ ಅನಿಸಿಕೆ. ಅದರಿಂದ ಅದನ್ನ ವೈಯಕ್ತಿಕವಾಗಿ ಡಿಸ್ಕಸ್ ಮಾಡಿ ಡಾಕ್ಟರ್ ರೇಷ್ಮಾ ಮೂಲಕ ಬಂದು ನನಗೆ ಡಿಸ್ಕಸ್ ಮಾಡ್ಬೋದು.
ಎಲ್ಲಿ ಹಾಸ್ಪಿಟಲ್ ಅಲ್ಲಿ ಸಿಗ್ತೀರಾ ಮೇಡಮ್ ನೀವು?
ಹಾಸ್ಪಿಟಲ್ ನಲ್ಲಿ ಸಿಗ್ತೀನಿ.
ಓಕೆ ಮೇಡಮ್. ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು ಮ್ಯಾಮ್. ಓಕೆ.
ಯಾಕಂದ್ರೆ ನಿಮಗೆ ಬೇರೆ ತರ ಟ್ರೀಟ್ಮೆಂಟ್ ಹೇಳ್ಬೇಕಾಗುತ್ತೆ ನಾವು, ಅದಕ್ಕೋಸ್ಕರ.
ಹೌದಾ? ಓಕೆ ಮೇಡಮ್.
ಬಟ್ ಮೈರಿನ ಕಾಯಿಲ್ ತುಂಬಾ ಚೆನ್ನಾಗಿ ವರ್ಕ್ ಆಗುತ್ತೆ. 100 ಜನಕ್ಕೆ ಹಿಸ್ಟೆಕ್ಟಮಿ ಪ್ಲಾನ್ ಮಾಡಿದ್ರೆ 95 ಜನಕ್ಕೆ ಅವಾಯ್ಡ್ ಮಾಡ್ಬೋದು.
ಹೌದು ಮೇಡಮ್, ಅದೆಲ್ಲರಿಗೂ ಸೆಟ್ ಆಗತ್ತಂತೆ, ಬಟ್ ನನಗೆ ಸೆಟ್ ಆಗಿಲ್ಲ.
ಮಾಡಿಸ್ಬೋದಮ್ಮ, ಡೋಂಟ್ ವರಿ.
ಓಕೆ, ಅವ್ರು ಹಿಸ್ಟೆಕ್ಟಮಿ ಸಜೆಸ್ಟ್ ಮಾಡ್ತಿದ್ದಾರೆ, ಅದು ನನಗೆ ಬೇಡ
ಅನ್ಸುತ್ತಾ? ನೋಡೋಣ.
ಓಕೆ ಮೇಡಮ್, ಥ್ಯಾಂಕ್ ಯು.
Good evening, Dr. Latha.
Namaskara.
This is.
Yeah.
Am I audible?
Yes.
I'm Dr. Harshita. Thank you for this very informative webinar. It was a pleasure to attend.
Thank you.
Doctor, I have one question. There have been studies which show that PCOS has been linked with consumption of dairy products. How far is it true? Because as Indians, we do involve a lot of dairy products in our diet. So to completely cut it off or to reduce it, it's not feasible for everyone.
True. I mean, I hear a lot of things about dairy products and estrogens. How far it is true, in how many parts of country it is true, we really don't know. People say that cows are fed with hormones to produce more milk. So that milk has hormones, and when we ingest it, we ingest hormones which can cause hormonal imbalance, and people manifest in different ways. So that is the explanation. But how true it is, how far, how much of hormones are there, in what sort of milk, in which products, we really don't know. This endocrine disruptive chemicals that is called EDC is there everywhere, starting from plastics to everything. So it is difficult to say that is the cause, but that is one of the causes.
Thank you, doctor.
Doctor, if I may quickly share in the same regard, I was also having the same issues. Whenever I consumed milk, I was having skin allergies or indigestion. I tried Gir milk, that is A2 milk, and since then I have not got any health problems related to milk. But whenever I consume regular milk like Nandini or Amul, I get lot of health problems.
Yeah,
Just
people do wait. Most of the dietitian off late are talking about not having dairy, not even for their coffee or not even buttermilk and things like that. So they are advising almond or groundnut milk or other sources of milk. So that's what people are oats milk and things like that. So we will have to, I mean, you will have to try it out and see. It's very difficult to sort of brand it that way, but a lot of news in the media.
thank you.
Yeah.
Madam
So,
wants to.
yeah.
Good evening, Doctor.
Maybe.
It was really a very nice presentation, lot of information. ನನಗೆ ಒಂದು ಪ್ರಶ್ನೆ ಇದೆ, I just wanted to ask. ಇವಾಗ young girls, like I have two daughters. So my question is, when they attain their menarche, say at the age of 13, 13 and a half, so immediately for the next 1 year, how should what is the right way to look after their health, in the sense with regards to diet agli, with regards to lifestyle changes agli, what should be the way that we should give them the I would like to ask your suggestion on that.
ಒಂದು ಫಿಸಿಕಲ್ ಹೆಲ್ತು, ಇನ್ನೊಂದು ಮೆಂಟಲ್ ಹೆಲ್ತು. ಫಿಸಿಕಲ್ ಹೆಲ್ತ್ನಲ್ಲಿ ರೆಗ್ಯುಲರ್, ಐ ಮೀನ್ ಕ್ವೈಟ್ ಹೈ ಪ್ರೋಟೀನು ಮತ್ತು ಕ್ಯಾಲ್ಸಿಯಮ್ ಇರೋ ಡಯಟ್. ನಾವು ಮೆನಾರ್ಕಿ ಆದಮೇಲೆ ತುಪ್ಪ ಕೊಡಬೇಕು, ಸಜ್ಜಿಗೆ ಕೊಡಬೇಕು, ಅದು ಕೊಡಬೇಕು, ಇದು ಕೊಡಬೇಕು, ಜಾಸ್ತಿ, ಐ ಮೀನ್ ಇವಾಗ ಬೇಡ ಅಂತಂದ್ರೂ ವೆಯ್ಟ್ ಬರ್ತಾಯಿದೆ. ಆದ್ದರಿಂದ ಜಾಸ್ತಿ ವೆಯ್ಟ್ ಪುಟ್ ಆನ್ ಆಗದೆ ಇರೋ ನೋಡ್ಕೋಬೇಕು. ಲೆಟ್ ದಮ್ ಈಟ್ ಹೆಲ್ತಿ ಆ್ಯಂಡ್ ಆಲ್ಸೋ ರೆಗ್ಯುಲರ್ ಫಾರ್ಮ್ಸ್ ಆಫ್ ಸಮ್ ಫಾರ್ಮ್ ಆಫ್ ಎಕ್ಸಸೈಸ್, ಒಂದು ಜಾಗಿಂಗು, ಒಂದಷ್ಟು ಓಡಾಟನೋ ಅಥವಾ ಡಾನ್ಸು. Encourage them to practice, I mean, take on some hobbies where they can be kept physically active also. The next thing is calcium supplementation. Kodi anta ಹೇಳ್ತೀವಿ because nearly 1 gram ಅಲ್ಲ, ಇನ್ನು ಜಾಸ್ತಿ ಕ್ಯಾಲ್ಸಿಯಂ ಬೇಕಾಗುತ್ತೆ ಅಡೋಲೆಸೆಂಟ್ ಪೀರಿಯಡ್ನಲ್ಲಿ, because that's the maximum that is the age where maximum bone density is developed. ಅದಕ್ಕೆ ಕ್ಯಾಲ್ಸಿಯಂ ಇಂಟೇಕ್ ಚೆನ್ನಾಗಿರಬೇಕು. ಕ್ಯಾಲ್ಸಿಯಂ ಒಂದು 500 ಮಿಲಿಗ್ರಾಮ್ವರೆಗೂ ಸಪ್ಲಿಮೆಂಟೇಷನ್ನು ಟೀನ್ಸ್ನಲ್ಲಿ ಕೊಟ್ಟರೆ ಒಳ್ಳೆಯದೇನೆ. ದಟ್ ಈಸ್ ಅನದರ್ ಥಿಂಗ್. ಇನ್ನೊಂದು ವಿಷಯ ಏನು ಅಂತಂತಂದರೆ, ಮೆಂಟಲ್ ಹೆಲ್ತು ವೆರಿ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟು. ಎಷ್ಟೋ ಹೊತ್ತಿಗೆ ಹೇಳೋದು, ಎಷ್ಟೋ ಹೊತ್ತಿಗೆ ಮಲ್ಕೊಳ್ಳೋದು, ಏನೋ ಇದ್ರ I mean, see, there will be lot of psychological changes also during menarche, because that individual, ನಾನೊಂದು ಇಂಡಿವಿಜುವಲ್ ಅಂತ ಅನ್ನೋದು ಎಸ್ಟಾಬ್ಲಿಷ್ ಆಗ್ತಾ ಇರುತ್ತೆ. ಸೊ lot of psychological changes will also be there. So provide a healthy atmosphere. ಯೋಗ ಮಾಡೋದಕ್ಕೆ ಎನ್ಕರೇಜ್ ಮಾಡಿ, ಹಾಬೀಸ್ಗೆ, ಮತ್ತು ಫ್ಯಾಮಿಲಿ ಟೈಮ್ ಕೊಡಿ. ಆಮೇಲೆ ಎನ್ಕರೇಜ್ ದೆಮ್ ಫ್ರಮ್, ಐ ಮೀನ್, ಟು ಕಮ್ ಔಟ್ ಆಫ್ ರಾಂಗ್ ಥಿಂಗ್ಸ್ ಅಂತಲೂ ಹೇಳಲ್ಲ. For example, spending a lot of time on the mobile or WhatsApp or computer, etc. ಅದನ್ನು ಕೂಡ ಕರ್ಟೈಲ್ ಮಾಡಿ ಅಂತಂತ ಹೇಳ್ತೀನಿ. ಬಟ್ ಈಸಿಯಾಗಿ ರೆಬೆಲ್ ಆಗ್ತಾರೆ. ಸೊ ಯು ಹ್ಯಾವ್ ಟು ಬಿ ರಿಯಲಿ ಫ್ರೆಂಡ್ಲಿ ಆ್ಯಂಡ್ ಸಿ ಹೌ ಬೆಸ್ಟ್ ಯು ಕ್ಯಾನ್ ಕೀಪ್ ದೆಮ್ ಫಿಸಿಕಲಿ ಆ್ಯಕ್ಟಿವ್ ಆ್ಯಂಡ್ ಮೆಂಟಲಿ ಹ್ಯಾಪಿ. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಫೇಸ್. ಅವರು ತುಂಬ ವೆಯ್ಟ್ ಪುಟ್ ಆನ್ ಆಗ್ತಾ ಇದ್ದರೆ, ತುಂಬ ಪಿಂಪಲ್ಸ್ ಬರ್ತಾ ಇದ್ದರೆ, ತುಂಬ ಅನ್ವಾಂಟೆಡ್ ಹೇರ್ ಗ್ರೋತ್ ಆನ್ ದ ಫೇಸು, ತುಂಬ ಇರ್ರೆಗ್ಯುಲರ್ ಪೀರಿಯಡ್ಸು, ತುಂಬ ಹೆವಿ ಬ್ಲೀಡಿಂಗು ಫಾರ್ ಪ್ರೊಲಾಂಗ್ ಪೀರಿಯಡ್ಸು, ಈ ಥರ ಎಲ್ಲ ಏನಾದರೂ ಇದ್ದರೆ ಆವಾಗ ಡಾಕ್ಟರನ್ನು ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡಬೇಕಾಗುತ್ತೆ. ಅದರ್ವೈಸ್ ಮೋಸ್ಟ್ ಆಫ್ ದ ಗರ್ಲ್ಸ್ ಕ್ಯಾನ್ ಬಿ ಮ್ಯಾನೇಜ್ಡ್ ವಿತ್ ಪ್ರಾಪರ್ ಡಯಟ್, ಎಕ್ಸಸೈಸ್ ಆ್ಯಂಡ್ ಮೆಂಟಲ್ ಆ್ಯಟಿಟ್ಯೂಡ್ ಟುವರ್ಡ್ಸ್ ದೀಸ್. ಯು ಆರ್ ಗೋಯಿಂಗ್ ಥ್ರೂ ಎ ಚೇಂಜ್ ಅಂತ ಅನ್ನೋದು ಭಾವನೆ ಬರಬೇಕು.
Thank you so much. Thank you.
ಕಾರ್ಬೋಹೈಡ್ರೇಟ್ ಆನ್ ದ ಹೋಲ್ ಕಟ್ ಮಾಡಬೇಕಮ್ಮ, ನಮ್ಮ ದೇಶದಲ್ಲೇ ಕಟ್ ಮಾಡಬೇಕು. ಬಿಕಾಸ್ ದಟ್ಸ್ ವೈ ಐ ಮೀನ್ ವಿ ಆರ್ ಥಿನ್ ಫ್ಯಾಟ್ ಇಂಡಿಯನ್ಸ್ ಹೇಳೋದು. ಅಪ್ಪರ್ ಅಬ್ಡಾಮಿನಲ್ ಫ್ಯಾಟ್ ಬೇಗ ಬಂದ್ಬಿಡುತ್ತೆ ವಿತ್ ಕಾರ್ಬ್ಸ್, ಫ್ಯಾಟ್ ಎಕ್ಸೆಟ್ರಾ ಎಕ್ಸೆಟ್ರಾ. ಹಾಗಾಗಿ ಯಾ, ಅದಕ್ಕೆ ಇಂಪಾರ್ಟೆಂಟ್.
Good evening, ma'am.
ಯಾ
Ma'am, what is the meaning of vasectomy, ma'am? Can you explain that?
ಒಂದು ನಿಮಿಷ, ಐ ಗಾಟ್ ಅನದರ್ ಮೀಟಿಂಗ್. ಇದು ಒಂದೇ
Okay, ma'am.
ಹಲೋ, ಯಾ ಸಾರಿ. ಹಿಸ್ಟೆಕ್ಟಮಿ ಅಂತಂತಂದರೆ ಗರ್ಭಕೋಶವನ್ನು ತೆಗೆಯೋದು. ಹಿಸ್ಟೆಕ್ಟಮಿ ಆ್ಯಂಡ್ ಊಫರೆಕ್ಟಮಿ ಅಂತಂದರೆ ಊಫರೆಕ್ಟಮಿ ಅಂತಂತಂದರೆ ಅಂಡಾಶಯಗಳನ್ನು ತೆಗೆಯೋದಕ್ಕೆ ಊಫರೆಕ್ಟಮಿ ಅಂತಾರೆ. ಹಿಸ್ಟೆಕ್ಟಮಿ ಅಂತಂತಂದರೆ ಸಂಪೂರ್ಣ ಗರ್ಭಕೋಶದ ಬಾಯಿ ಮತ್ತು ಬಾಡಿಯನ್ನು ತೆಗೆಯೋದಕ್ಕೆ ಇದು ಹಿಸ್ಟೆಕ್ಟಮಿ ಅಂತಂತಾರೆ.
Ma'am, then what about tubectomy, ma'am?
ಟ್ಯೂಬೆಕ್ಟಮಿ ಅಂತಂತಂದರೆ ನಾನು ಸ್ಲೈಡ್ ಶೇರ್ ಮಾಡಿದಾಗ ಟ್ಯೂಬ್ ಒಂದು ಚಿತ್ರ ತೋರಿಸಿದ್ದೆ. ಆ ಟ್ಯೂಬನ್ನು ಕ್ಲಿಪ್ ಮಾಡೋದು ಅಥವಾ ಕಟ್ ಮಾಡೋದು, ಸೊ ದ್ಯಾಟ್ ಎಗ್ ಫ್ರಮ್ ದ ಓವರಿ is blocked from meeting the sperm. That is the purpose of tubectomy, and that's what is done.
Thank you, ma'am.
Thank you very much, madam. Seems like madam is a very busy person. In spite of her busy schedule, she made a time for us. She spent quality time with us and shared immense knowledge regarding women's health. I think we should all express our gratitude to her. I think it's now time to propose the vote of thanks. I would like to call upon Leo Gungun Surana to propose the vote of thanks, please.
A very good evening to everyone. It's my privilege to propose the vote of thanks. We all had a great evening and enjoyed this talk thoroughly. It was an eye-opener for all the women and girls here. I express my gratitude to the guest speaker, Dr. Lata Venkatram, for giving a wonderful talk on wellness in women. Dear Madam, thank you very much for sparing your valuable time and enriching our knowledge through today's talk. I would like to thank PMCC Lion, Dr. S. Nagraj Rao sir, for always promoting and encouraging the Leos to take up active participation in the programs. I would like to express my gratitude to Dr. Reshma, who made it possible to invite the guest speaker. Thank you, Madam. I thank Presiding Officer, Lion K.N. Srinivas sir, for your support. Thank you, sir. I thank Leo Ella and Leo Tanmay for organizing this program. Lastly, I would thank each and everyone present here. Good night, all.
Thank you very much, Gungun. We have our virtual dinner ready. I request Leo Rohini Rao to present the dinner, please.
Thank you, Leo Tanmay. Since today we spoke about health, let's have a healthy dinner. I'm just trying to share my screen. Is my screen visible?
Not yet.
Not yet.
sir.
Hello, namaskara. Namaskara, sir. Yeah. Hello.
I apologize, I'm not able to share my screen. Leo Tanmay, I have just shared it with you. Can you please check?
It's okay, Rohini, if you can't share. Srinivas ಅವರು ಕೈ ತೂತ್ ಹಾಕ್ತಾರೆ ಈಗ. 2-3 ಸಲ ಬಾಯ್ ಬಿಟ್ರು ಏನ್ ಹೇಳ್ಬೇಕು ಗೊತ್ತಾಗ್ಲಿಲ್ಲ ಅವ್ರಿಗೆ. Srinivas, 30 seconds, go ahead.
No, I was waiting for Rohini. what's the dinner she is going to share? Just what? It's a mouth watering actually. Okay. Anyhow, I want to tell that.
WhatsApp ನಲ್ಲಿ share ಮಾಡಿ.
Hello. Yeah, I recognize that Dr. Harshita. She joined from Dubai. She's my would-be daughter-in-law. Just wanted to tell that. Yeah. Yes. Thank you, madam. Thank you, Dr. Madam. Very good information. Even though we gents, a lot of things we came to know today. Because ಯಾಕೆಂದ್ರೆ ಮನೇಲಿ ಹೇಳ್ತಾ ಇರ್ತಾರೆ ನಮ್ಗೆ ಸುಮಾರು ವಿಷಯಗಳು ಗೊತ್ತಿರೋದಿಲ್ಲ. But today we learned a lot of information. Thank you, madam. It was very fine.
ನೆಕ್ಸ್ಟ್ ಲೈಫ್ ಕೆಲ್ಸಕ್ಕೆ ಬರುತ್ತೆ ಶ್ರೀನಿವಾಸ್ ಅವರೇ.
ಹೇಳಿ ಸರ್.
ನೆಕ್ಸ್ಟ್ ಲೈಫ್ ಹೆಂಗಸರಾದ್ರೆ ನಿಮಗೆ ಕೆಲ್ಸಕ್ಕೆ ಬರುತ್ತೆ ಅಂದೆ.
No, I will follow you, sir.
Don't follow me. ನಂಗೆ ಪೂರಾ ಮೋಕ್ಷ ಇದೆ ಲೈಫ್ ಒಳಗೆ.
ಹೌದಾ? ಇಲ್ಲ ಸರ್. You have to serve a lot. ಇನ್ನು ನೀವು ತುಂಬಾ ಸರ್ವ್ ಮಾಡಬೇಕು ಸರ್. Lot of expectation from you, sir.
Yeah, women will feel that you're understanding them more, sir.
Yes.
Nagaraj sir.
Sir.
Sir will follow you ante sir. Usharu. Nimman munde ಬಿಡ್ತಾ ಇದ್ದಾರೆ.
Any improvement?
Virtual dinner is waiting.
Yes, apologies for the delay. I've just shared it with her. We are working on it. Please allow us a few minutes.
Madam herself had posted some nice dishes, Rohini.
ಹೌದಾ?
ಅಲ್ಲ ಸ್ಲೈಡ್ಸ್ ಅಲ್ಲಿ ಮೇಡಮ್ ತೋರಿಸ್ತಿದ್ರು ಡಯಟ್ ಚಾರ್ಟ್ ಎಲ್ಲ.
ಡೈಟ್ ಹೌದೌದು. ಅದ ಡೈಟ್ ಕೇಳ್ಬಿಟ್ಟು ಈಗೆಲ್ಲ ಬೇರೆ ವರ್ಚುವಲ್ ಇದು ಕೊಟ್ರೆ ಹೇಗಿರುತ್ತೆ?
Sorry, sir. Today I had planned for a healthy dinner, but screen sharing, problem ಆಗ್ತಾ ಇದೆ. I'm extremely sorry for this.
No problem.
ಸರ್, ಲತಾ ಮೇಡಮ್ದು ನಂಬರ್ ಶೇರ್ ಮಾಡೋಕ್ಕಾಗುತ್ತಾ ನೋಡಿ ಸರ್? ಆಮೇಲೆ ಅವ್ರು ಏನಾರು ಆರ್ಟಿಕಲ್ಸ್ ಬರೆದಿದ್ರೆ ಅದು ಎಲ್ಲಿ ಸಿಗುತ್ತೆ, ಏನಾರು ಐಡಿಯಾ ಇದೆಯಾ?
That only Lata madam can tell to share the number or not.
Through Dr. Reshma, we can contact her.
Okay, all right, thank you.
ದಾದಾ ಪೇರ್ ಅವರು ರೇಷ್ಮಾ ಅಂತ ಇವರು ಮಹಾವೀರ್ ಜೈನ್ ಹಾಸ್ಪಿಟಲ್ ಗಿರಿನಗರ್ ಅಲ್ಲಿ ಇರ್ತಾರೆ.
Okay,
you can contact ಅವ್ರನ್ನ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡಬಹುದು.
She is our line member.
Yes,
through her you can contact her.
ನಮಗೆ ಶ್ರೀನಿವಾಸ್ ಸರ್ ಇದ್ದಾರೆ ಮೇಡಮ್, ದಟ್ಸ್ ಎನಫ್ ಫಾರ್ us.
ಸರಿ.
Okay.
Thank you.
Unfortunately, we cannot serve the dinner virtually today. Whereas you can always go back to your dining table and have the real dinner.
We can have a physical dinner. We can have no virtual today.
Definitely. Yes, sir, definitely. Yes. Thank you everyone for supporting, for being here and for participating. Thank you everyone. Good night. Stay safe.
Okay. Thank you. Good night.
Have a nice weekend and be careful. Corona is not yet gone.
Yeah. Thank you, Tanmay. Wonderful.
Good night.
Thank you, sir.
Ela, you get 10 out of 10 and Gungun, you get 10 out of 10.
Yes. Oh, fine.
You get 11 out of 10.
Thank you, sir.
Why, sir? 100 out of 10.
100 out of sir. Okay, sir.
ಅಲ್ಲ ನೀವು ಮದುವೆ ಮಾಡಿ ಹೊರಟಿದ್ರಲ್ಲ, ಎಲ್ಲ ಮಾರ್ಕ್ಸ್ ಬೇಕಾಗುತ್ತೆ ನಿಮ್ಗೆ ಅಂತ.
Okay.
I didn't share dinner today.
ಸರ್ ನಿಮ್ಮ ಆಶೀರ್ವಾದ ಇದೆಯಲ್ಲ ಅಷ್ಟೇ ಸಾಕು ಸರ್ ನಮ್ಗೆ.
ದೇವ್ರು ಒಳ್ಳೇದ್ ಮಾಡ್ಲಿ.
ಮದುವೆ
ಮಾಡಿ ನೀವು ಯೋಚನೆ ಮಾಡಬೇಡಿ.
Sir, KN Srinivas told he will follow you. I mean, he's planning to become governor first, then MCC. Yes.
No, sir. Good evening.
That no, in Lionism you can follow.
Okay. Oh, nice.
And after
Thank
that,
you everyone. Good night.
Okay, madam. Good night, madam. Okay. Good night.
Good night. Thank you. Bye-bye.
Okay. Bye-bye. Okay, Dada. Bye-bye. Okay, Harshita. Okay. See you. Bye-bye.
Thank you, uncle. Good night.